families. RadioDoctor is Nigeria's first specialized health program where medical doctors consult for free and advise you on women radio. This program airs from 10 a.m. Mondays through Fridays.
And today's program is proudly powered by TeleDoc, a secure digital platform that allows you to consult verified doctors anytime, anywhere. With TeleDoc, you can book a quick consult for 10 minutes or a full consult for 30 minutes. Choose your preferred time, join a secure video call within the app. You can also upload your medical records, receive prescription digitally after your consultation. Every Wednesday and Thursday, we feature trusted doctors from the TeleDoc network to answer your health questions live. My name is Dimladi Okewale.
And I'm Fumi Bangala. Today, we're talking about a condition that many people have heard about, but don't fully understand: breast cancer. For some people, it feels like something that happens suddenly. For others, it's something that they're even afraid to check for. When you say, oh, do monthly examinations, go to the doctor to check for XYZ, they're afraid to go check for it. But the truth is, as with any other illness, early detection can save lives.
We'll be discussing how to recognize early signs, what increases risk, treatment options available, and how platforms like telemedicine are helping people access care earlier and more easily. Joining us today is Dr. Osaro Arabem, a TeleDoc partner doctor who will guide us through understanding breast cancer and how to take proactive steps towards prevention and care. Doctor, you're welcome to the show.
You're welcome to the show. The phone lines will be open shortly for you to ask your questions. Again, this is RadioDoctor. This is Women Radio 91.7. And Dr. Osara is here to talk to us about breast cancer. Okay, over to you, Demi.
Doctor, good morning.
Good morning, everyone. I'm glad to be here.
Good morning. Okay, let's start with the basics. What exactly is breast cancer?
Okay, thank you for the question. Breast cancer, it means abnormal growth of breast cells that has evaded the normal regulatory mechanisms. So that's what it simply means. And these abnormal breast cells, they can stay within the breast, or they can pass through the basement membrane of the breast and go into the systemic circulation and affect other vital organs. So that's what it simply means. Thank you.
Okay.
Thank you, doctor. How does breast cancer develop in the body?
Okay, like I said, the development is the cause is not actually known. Is an interplay between environmental and genetic factors. So the cause is not actually known, but there are certain risk factors that can predispose an individual towards developing breast cancers. So if you permit me, I can dive into the risk factors.
Yes, doctor.
The risk factors can be modifiable. What that means that it can be preventable or non-modifiable. That is not preventable risk factors. For the non-modifiable risk factors, we have age. Breast cancer is common with advancing age. It's common for those that are greater than 45 years. They are prone to developing breast cancers. However, individuals that are also less than 45 years can also develop breast cancer, but it's commoner with advancing age. And for those that are less than 45 years developing breast cancers, theirs is more aggressive than those with an advancing age. The other modifiable risk factors include sex. 99% of breast cancers are common in females. It can also occur in males. Genetic distribution, inheritance. About 10% of breast cancers are linked with genetic mutations. That means that it can be inherited from parents. So we also have other non-modifiable risk factors like patients, a woman who has had previous breast diseases. They are also at risk of developing breast cancers. For the preventable risk factors, we have things like there's what we call endocrine factors. Endocrine, because breast cancer is a cancer that rely on an hormone called estrogen for its growth. So so anything that expose a woman to prolonged estrogen, we accelerate the growth of the cancer cells. So for the endocrine factors, we have things like early menarche, late menopause, patient patient who is also having her first childbirth at a very advanced age, like greater than 35 years, they are prone to developing breast cancers. Also, patients who is on a hormonal replacement therapies, they are for prevention of pregnancies. They're also prone because, like I said that the breast cancers, they rely on estrogen. Estrogen is their food that accelerates the growth. So anything that prolong estrogen exposure will predispose the female to breast cancer. We also have other risk factors like dietary risk factors like alcohol, smoking, patient that is obese. So all these predisposes the female to developing breast cancers. Thank you.
Thank you, Doctor. I know you touched on the age factor, and you said 45. Can younger women also be affected by this? People younger than that age range?
Yes, younger women can be affected, but like I said, it's commoner with advancing age. And for the younger genders, their own cancer is more aggressive. And the prognosis is also worse for them. So it can affect younger women, but it's commoner with advancing age, greater than 45 years. Thank you, sir.
Okay, thank you. Over to you for me.
I'm just like, wow. Okay. What are the early warning signs of breast cancer that women should never ignore?
Okay, thank you for this very wonderful question. The early signs, once any woman develop a breast lump, she should seek medical attention, because that can be a breast cancer developing. And in our environment, because of our lack of knowledge, most of our patients present late with this pathology. So early, once you see any breast lump in your breast, or once there's any nipple discharge that is bloody, once there's any bloody nipple discharge, or once there's any skin changes like orange pea, you are seeing your skin of the breast looking like orange pea, or once you palpate any breast lump, you should seek medical attention as soon as possible. Thank you.
Okay. How important is regular breast self-examination, and how should it be done correctly? Hi, doctor.
Sorry, you said?
I said, how often should we do the breast examination?
Okay, thank you.
And how important is the breast examination itself? Okay,
self-breast examination is one of the two for screening,
right,
for breast cancer. So it is advocated that it should be done at 7 to 10 days of the menstrual cycle.
Okay.
So it should be done. It should be done. There's no specific time frame that it should be done. Once a woman that is, of childbearing age, reproductive age, we always advocate for self-breast examination. Okay. So it's a tool for screening for breast cancer. Thank you.
Right. And then how do you do it? You mentioned that you do it shortly after. A woman should do it shortly after she's done with her period. But what is the examination? Can somebody self-examine themselves?
Yes, yes, it's done when lying down. You lie
Okay.
down instead, and you lie down, and you use your palmar surface of your hand to palpate each quadrant of the breast.
Mm,
The breast is divided into 4 quadrants. So I don't want to bore you with those
okay.
medical terms. So you palpate each of those 4 quadrants. And if you suspect any lump, you should seek medical attention as soon as possible.
Mm.
Thank you.
All right. Thank you so much for that. So, what age can women start routine screening like mammograms?
Okay. In our environment, mammogram, like I said, is also a tool for screening.
Mm,
So in our environment, it is advocated that women that are 40 and beyond should have a mammogram, and it is done every year, yearly. Can I
every
be
year.
heard?
Yeah, I can hear you. Yes. Should be
So
done every year, you said. Yeah.
yes, it's done yearly, every 1 to 2 years.
Is there any particular age they should start, or is it at any point in time?
No, there are indications for it. Like I said, women who are 40 years and above should have mammogram.
Okay.
There are other indications. For example, a patient who have had what we call breast conservation for breast cancer,
Mhm.
the other breast should also be screened. Those who have had a surgery, the other breast should also be screened yearly, as about 10% of them can develop cancer of the other breast.
Right.
Patients with a high risk of developing breast cancer, for example, those who have a strong family history, it's also advocated that they undergo mammogram yearly. So these are some of the indications for mammography. Thank you.
Hmm. All right. Um, can men develop breast cancer?
Yes, like I said, I told you that about 99% of breast cancers is common in females. However, about 1% is common in the male folks. So males are also at risk of developing breast cancer, but it's very rare. Thank you.
So what happens? So when a man, how can a man know that he has breast cancer? Because for women, you had mentioned that when you start seeing discharge, maybe if it's milky or if it's bloody, then you should go to the hospital. And in a country like ours, which you rightly said, we're not keen on going to the hospital at all for anything. People literally think that the moment they go to the hospital, they're going to come back with an ailment. How would a man now know that he has breast cancer? How does he check himself to know?
Yeah, the symptoms, the clinical features are also the same.
Okay.
First, there will be a lump, there will be swelling at the breast.
Okay.
So there will be a lump. There can also be nipple discharge, bloody nipple discharge. In our environment, that because of our poor health seeking and behavior that will
Mm-hmm.
present late, there can be this patient. They can present with features of distant metastasis,
Mm-hmm.
like cough, difficulty in breathing, because the tumor has spread to the chest, to the lungs, to be specific. They can present with difficulty with walking, because the tumor has spread to the backbone vertebra. So in our environment, they can either present with features of localized tumor
Okay.
or features of advanced malignancy. Thank you.
All right. Thank you so much for your responses. They're still tuned to Women Radio 91.7 FM, the voice of women. This is Radio Doctor, and we're speaking with Dr. Osaro on breast cancer this morning. You've been talking about, we present late. What happens if and when the breast cancer is detected late?
Yes. Because like I said, because of our poor health seeking behavior and because of other factors, religious factors. Most times, when females in Nigeria and other West African countries develop breast lump, they don't present to the hospital. They first went to the chemist, prayer houses before they will not present
Very true.
at late stage to the
Very
hospital.
true.
So those are some of the challenges we faced in this our environment.
Mm.
So those are some of the reasons for late presentation in our, and also because we are still developing, though we have that challenge have been solved. We now have equipment to detect early breast cancers
Mhm.
once they present, even those that what we call that are not palpable, on a
Yeah.
clinical examination. You can detect them using diagnostic facilities
Right.
like mammogram. And mammogram is present almost in every cities in Nigeria. So because of our improvements in facilities, we can detect early breast cancer. But we still have those challenges I enumerated before. Thank you.
Thank you so much, Doctor, for that. My final question before I hand over to Demi is: what are the treatment options available today for
Okay,
breast cancer?
okay, thank you very much. The treatment of breast cancer is multidisciplinary. So
Okay.
it's not just the surgeons alone. It involves other specialties like the surgical oncologists, the radiographers, the nurses. So for breast cancers, the treatment modalities include surgery. That is,
Mhm.
you are removing the breast.
Yeah.
You are removing the breast, the tumor of this. You are removing the breast along with the tumor. It's other surgery. We also have other modalities like cytotoxic chemotherapies.
Right.
These are special kind of drugs that attacks cancer cells.
Okay.
We also have the new treatment which is now in vogue. We call it targeted therapy. The use of hormonal therapy,
Okay.
the use of immunotherapy, and also radiotherapy. So those are the treatment modalities
Right.
for treatment of breast cancer. Thank you.
Okay. All right. Thank you so much. Demi, over to you.
Okay, thank you, Doctor. Doctor, for people listening who may want to speak to you further, how can they reach you?
Okay, okay, man. You can reach me on IG. My name is Osaro Arebame, and my Instagram handle is at Dr. Arebas. You can also reach me on my phone number 247. My phone number is 090 73 66 7372. That's also my WhatsApp number. Thank you so much.
Okay, Doctor. And you can also consult Dr. Osaro on the TeleDoc platform from the comfort of your home, making it easier for you to access care without unnecessary stress. You're
Oh,
listening to
okay.
Radio Doctor on Women Radio 91.7, powered by TeleDoc. TeleDoc allows you to book at your preferred time, join a secure video call, upload your medical records, and receive prescriptions digitally. It's healthcare made simple and secure.
Yes, yes, yes. The phone lines are now open: 07000 or 09155 You can call our toll-free line on 0800 1235 917. Demi, over to you.
All right, Doctor. So for someone that is dealing with cancer, how can telemedicine help them in such situations?
Okay, thank you so much for this question. For telemedicine is also a tool that can help them with information about what breast cancers entails. Like I said, early detection is very pivotal to the treatment of breast cancer. So with telemedicine, they can learn what is screening, how to go about screening for breast cancers. They can also know about the early clinical manifestations for breast cancers. They can also know with telemedicine, the people listening, they can also know about the how to diagnose breast cancer and also the treatment options that are available. And also telemedicine can also help to to correct the perception or myth that people might have about breast cancers. Thank you.
All right, thank you, Doctor. So in terms of early detection and guidance before hospital visits, can telemedicine be used for that purpose for someone that is dealing with cancer?
And like I said, but cancer is a multidisciplinary thing.
Okay.
Telemedicine is just a way of a way of the message, enlightening the public about breast cancer. But it's advisable that patients should visit teaching or tertiary hospitals for proper evaluation and care. Thank you.
All right, thank you, Doctor. And for people who don't have access to hospitals, for instance, people in remote and underserved areas, how for them, what would be their alternative? Would it be telemedicine, or what would happen?
To be honest, for breast cancer, there is no alternative because you have to be in the hospital so that the different so that patients can be properly evaluated and treatment commenced as soon as possible. Because one thing with breast cancers, the earlier you start, the better for the patient. Because once the cancer cells have spread beyond the breast to other vital organs, the possibility of treatment will be very slim. So for the role of telemedicine is just to spread the news, is to alerting the public to what breast cancers entails. I think that is the role I think that is what that is the gap telemedicine should cover. Thank you.
Okay, Doctor. You've answered my next question, which would have been for follow-up and monitoring as well. Over to you, Phil.
Okay, just to take you back to something you had said, that when people when there's like breast cancer, when they notice something, they turn to chemist or traditional care. How does this impact the outcome for the patient?
How does this impact the outcome?
Yes, people turning to alternative medicine first or traditional care first. Yeah.
So the outcome is not good at all. It's not good because a patient that you as a doctor you could have salvaged the situation for the patient, but because of the delay, they will not present late. Some even present with what we call fungating breast cancers. Breast will be, or there will be ulcers everywhere.
Okay.
There will be the tumor cells sometimes have spread to it. So you can do nothing at that stage. At that stage, it's just palliative care, end of life care, symptomatic care. So you can't really do nothing at that stage. So the impact is very, very, very is not very good at all. The impact of this delay is not very good.
Okay, so what role do family members play? Because, it's one thing to say, oh, I think this is what is going on with me. It's another thing for the family members to be supportive. What role do they play? Should they encourage early care? Should they delay it? How does this also impact the outcome for the person with the cancer?
Thank you for these wonderful questions. I was expecting it. For cancer is very is very demanding, both physically, finance. Is very demand. So the woman needs everyone's around. And in Africa, in Nigeria, you know that most times people still attribute breast cancer to to might, to spirits.
Yeah.
They still believe that cancers are caused by witches and wizards. So most times, even in our clients, you see the husband divorcing the
Hmm.
woman, leaving
Hmm.
the woman,
Hmm.
just because the woman has breast cancer. So
My man.
breast cancer is very demanding financially. Most patients with breast cancer, because there's no family support, they can even go into psychosocial, depression. They become depressed, and that will impact on the outcome negatively. So we need everyone around us. Thank you.
Thank you. What about healthcare providers as well? Because someone comes to the hospital, you find out the person has cancer. What are there some mistakes that your counterparts, some healthcare providers make when they are dealing with, for instance, now when I go to the hospital, especially times when I was pregnant, I'm very, very, I'll give an example. I was pregnant at some point, maybe 2021 or so, and I was sick before then. I had miscarriages before. I was sick before then. And when I went to do the scan guy downstairs had said, he just said, "Do you have other children?" I said, "Yes." He said, "Are they alive?" And I was so confused because the fact that I have other children, what impact does that have on the fact that I'm doing a scan that I am pregnant? Then the next thing was like, he was very, very careless. I'm not gonna lie, he was very careless and very insensitive, when he was speaking to me. I cannot tell you that if I saw that man now, I would recognize him. I don't, but that scarred me a lot, even up until now. Another time, I think that same pregnancy, I had to now do an evacuation. I'd gone to a federal hospital, and that's one of the reasons why I cannot step there again. And the way they handled me during that process, it's one of the most traumatic experiences I've had in my life, right? So I give those examples to say that wouldn't you say that there's some mistakes that your colleagues, I know you might not want to call them out or say anything against them, like, aren't there some mistakes that they make when dealing with anxious or fearful patients? And what should be the solution, speaking to your fellow colleagues now?
Okay. Thank you very much for these questions. Like I said earlier, the treatment of breast cancer is multidisciplinary, and you must be very clear with the patient. You have to tell the patient the truth state, because most patients, they also add to this issue. They don't want to know the true state. They want you to tell them what they want to hear. They don't want to know. You tell a patient that your biopsy result came out to be breast cancer. The next thing is, God forbid, I'm not the one. It's not true. So most times, patients also contribute to these issues. But as a doctor, you must tell the patient the truth.
Right.
You don't have to bend anything to suit the patient. Well, most times, what patient does, they will not once you tell them that they have breast cancers, they will not be seeking for different opinions. They will not be going from one hospital to another just for them, just be seeking for second opinions, because they are looking for somebody to tell them what they want to hear. So for my advice for my colleagues is that always be firm. Tell the patient the true state of things. Don't downplay anything. That's my advice to my colleagues. Thank you.
All right. Thank you so much. I think you already talked about misinformation and how it's, misinformation in terms of oh, it's your, maybe it's a demonic power at play is why you have cancer and things like that. Okay, I'm just going to hand over to Damien.
All right, thank you, doctor, for all the answers. What lifestyle habits can help reduce the risk of breast cancer?
Okay, thank you very much. Like I said, the risk factors, the modifiable risk factors, that is the preventable risk factors,
Yeah.
also include dietary modifications. Alcohol, stop. We should reduce our intake of alcohol. Smoking, because smoking contains some cytotoxics that can induce genetic mutations that can predispose to breast cancer. So we should stop smoking. Also, like I said obesity is also a risk factor. Yes, obese, because once a patient is obese, their fats can be converted to estrogen. Like I said, estrogen is the food for breast cancer proliferation. So we should try to also reduce our weight. Those are some of the lifestyle, the extreme modifications. Thank you very much.
Thank you, doctor. How do financial concerns shape treatment decisions, especially when long-term care is required?
Yeah. Thank you so much for this question. Like I said, the treatment of breast cancer is required funds, is required money.
Yeah.
Because the cytotoxic alone, because it's given at we give it in cycles every 28 days. So it costs, and it's not just one. We give combination drugs. So it costs a lot of money. So now you need funds. You need funds for because it's a long-term thing. You need funds, and also thank God for cancer health funds. So patients with breast cancer, they can apply for cancer health funds.
Okay.
They can also help them with finances. Thank you.
Thank you, doctor. So in terms of misconception, what's the most dangerous misconception people still hold till this date about breast cancer?
The most common is attributing it to spiritual issues. In Africa, people still aspirate breast cancers to spiritual problems. They still think that it's caused by witches and wizards. So that's one of the most prominent misconception in our environment. Thank you.
Okay,
All right. Okay, so what should someone expect during their first hospital visit for a breast concern?
Okay, thank you very much. So once you get to the hospital first, because first thing is for a doctor to take history from
Okay.
you. Doctor wants to know when you notice the breast lump, how it has progressed, if the lump has increased in size since you noticed it. The doctor also wants to know if there's nipple discharge,
Okay.
if there are skin changes, if there are also what we call metastatic symptoms. If you want to know if the tumor has spread beyond the breast. So there are certain questions that the doctor will also ask. After then, the doctor wants to also want to palpate the breast himself,
Okay.
to also palpate the armpit, the axilla, to know if there are lymph nodes there.
Okay.
And also after then, we now want to do what we call, we want to diagnose this breast cancer histologically. So we want to biopsy the lump and go and look into it under the microscope to know if the tumor is really cancerous or is what benign. So after that is how for those that are greater than females that are greater than 40 years, we do mammogram for them. While those that are less than 40 years and below, because of their dense breast, we do breast ultrasound scan for them. So these are some of the ways we we go around breast lump. Thank you.
Right. So what if a patient refuses treatment? I'm sure that you've seen that time and time again. Are there any ethical challenges in this kind of case, or is it a case of the hospital will say you're going to have to write an undertaking that you refuse treatment, all those kinds of things?
Yes, once you see a patient, like I said, you will explain, you will counsel the patient as a very robust counseling. So you tell the patient the outcome of this disease, the stage, the treatment modalities. So if the patient refused treatment, so the patient will have to sign, and you will document very well that patient refused treatment despite adequate consent. So you must sign, because these days that lawyers, we have hungry lawyers everywhere. They're walking around the
Wow.
hospitals looking for doctors.
Wow.
So we are very wise nowadays. So we don't take anything for joke.
Yeah.
So that is it. Thank you very much.
Now you say we have hungry lawyers. Oh, wow. But have you had any personal experience where a patient refused treatment? Can you share with us? If
Yes.
it's okay for you to share with us. So.
Let's just leave it like let me just answer it using yes. I've had some cases like that, but I don't want to go beyond this.
Go beyond that.
Because of Thank you very much.
That's fine. Do you think that breast health education should be introduced in schools? Because we have a culture of stigma where everything is hush, hush, hush. But do you think it's important to introduce this early in schools, especially for young girls and for women?
Yes, I think it's important because it will help to detect these breast lumps at an early stage. So if government, I think government has a role to play in this,
Yes.
And also they have a role to play in this. So it is important. And also our media houses, like people are doing now, radio houses also have a role to play to educate the public about early detection of breast cancers. Thank you.
All right. So let's talk post-care. What happens after maybe treatment, radiation, or chemotherapy, whichever one? What happens to the patient after? Can the breast cancer... So it's like two questions I'm asking. What happens for post-care, and then can the breast cancer still return?
Okay, thank you very much for this wonderful question. Post-care, post-care can be divided. Is it surgery? Following surgery, we follow our normal routine. Patients, after the surgery, patient will be in the hospital for some days. We'll assess the wound to ensure that the wound has healed properly.
Yeah.
The drain, we remove the drain. Then we now discharge the patient and follow them up in clinic. The tumor that we remove, we won't throw it off. We'll send it for histology to know the tumor type, the tumor grade, and also to know that it will also tell us that the surgery, if it's adequate, if it has removed every part of the cancer cells. Then we also follow them up with what we call adjuvant therapy. We give them radiotherapy. Radiotherapy simply means using special kind of light to kill those remaining, because your surgery most times we don't take care of every of the tumor. There will still be some residuals. So those residuals was the radiotherapy we now take care of. We also give them hormonal therapy, like I said, targeted therapy for about 5 years. So for that is for the first part of the question. You said what was the second part again? Sorry.
I was saying that, so I asked about what happens, and then post. Which one did you answer? Did you answer for post care now?
Post care.
Yes. So you answered for post-care. I don't remember what I asked now for the second one. David, please help me. I can't remember. What did I say now?
No, it was post-care.
Post-care. I asked 2 questions in one. I'm trying to remember the second one. I don't remember. I don't. Okay. As we round off, let me ask one more question. Do you think that the reason why a lot of women refuse to go for treatment is because sometimes it might be required for them to maybe surgically remove both breast or one breast?
Yeah, you are very correct. Most, the breast of a lady is very sensitive, and it's very sensitive, both sexual and physical appearance is very important to the female folks. So sometimes most of them are afraid of you removing that breast. So they don't want to come to the hospital. They prefer going to prayer houses where they will be praying for them and telling them that it's caused by witches or wizards. So they don't want to come to the hospitals because they don't want the breast to be removed. So that is just the honest truth. Thank you.
The amount of times that you have made reference to spiritual, like people, and to be fair, I'm just laughing because I'm sure that in your practice, this is something that you have seen time and time
Yes,
and again.
yes,
So
yes.
interesting. And one of the doctors that we speak to as well, every time he used to live in America and then came to Nigeria, and he said the culture shock he felt was a lot because every time people came to the hospital, they would say to him, "Allah, my jail is not my portion," and he couldn't understand it. And he even cited examples of how even when he goes to churches to give talks, he would hear, or mosques to give talks, he would hear either the imam or the pastor say, "It's not your portion, stop using your drugs," and things like that. And every time he sees it, he's way better now. He still can't wrap his head around it that your life is literally slipping out of you, you're losing it, and then you're saying that it is spiritual. He said he would say, "Is it not God that gave us wisdom to be able to use science and technology?" So yeah, it's just really, really interesting. But yeah, over to you, Jamie.
Thank you very much, Dr. Sarah Arabe, for today's free consultation and advice on breast cancer, early detection, treatment, and how telemedicine supports care. If you need to speak to the doctor privately, download the TeleDoc app, book a full 30-minute session, choose your preferred time, and you can speak securely via video call and receive prescriptions digitally. All you need to do is search for Dr. Osaro Arebemen.
Thank you so much. Thank you so much, Dr. Sarah, for coming. Again, thank you for listening. Thank you for being a part of today's conversation. Radio Doctor on Women Radio 91.7 is Nigeria's first specialized radio health program, broadcast Mondays through Fridays at 10 a.m. You want to join us tomorrow for another edition of Radio Doctor. Again, thank you, Dr. Sarah, for coming on the program today.
It's a pleasure for having me, and I appreciate and I really enjoyed my time. Thank you so much.
Thank you, Doctor.
So much. Many thanks to Rachel and Benjamin who are producing us today, and the executive producer, Tomoke Shanaya. My name is Fumi.
My name is Demi.
To have a healthy day.